Alright guys, in this quick session I am going to discuss the Telegram quiz session 2, whose first topic was embryology and anatomy. Those of you who are not aware of that Telegram group, I have put the name of the Telegram group here. You can see it's Ophthalmology by Dr. Manish Chhabra, and I have also shared my Insta ID, which is I_Manish. You can also see it in the description. Right now let's discuss first question. It is pretty straightforward, single liner. The eyeball starts to develop in, so the answer is 22nd day of gestation. But coming over to the second question, so it is about the anatomy of the iris. But I always say, if you can understand embryology well, anatomy is a cakewalk for you. So there is a optic stalk, which is protrusion from diencephalon, which is a part of prosencephalon. You know the parts of the brain: prosencephalon, metencephalon and telencephalon, forebrain, midbrain and hindbrain. From the prosencephalon there is a part of diencephalon from which there is arising of the optic stalk, and this optic stalk's distal end gets transformed into optic vesicle, which later gets transformed into optic cup. So I am talking of optic stalk for now. So this is your optic vesicle, which will later get transformed into optic cup. Now this optic cup has got inner part and has got outer part. The outer part forms the retinal pigment epithelium, while the inner part forms the neurosensory layer. So what is neurosensory layer, boys and girls? It is the inner 9 layers of the retina. Yes, and there was a question which was asked in your recent INICT, which is November 2024 exam, that all of the following structures develop from neural crest except, and there was one option which was retinal pigment epithelium, and the answer is retinal pigment epithelium. Why? Because the optic stalk is coming out from diencephalon, which is a part of prosencephalon, which is neuroectodermal in origin. So RP is neuroectodermal in origin. Yes, now when the optic cup is getting closed, when it reaches the periphery, so basically you know that RP and neurosensory layer, they together forms the 10 layers of the retina. Neurosensory layer is inner 9 layers, while the outer 10th layer is your retinal pigment epithelium. Now when it is getting closer, so what happens is, so there is ciliary body first. So there is ciliary body, and later then there is formation of iris. So here there is ciliary body, and then later there is formation of iris. Now what are the, how many layers of the ciliary body are there? So ciliary body has got 5 layers. Yes, so 5 layers. So if we start from inside to outside, you need to understand very important concept. Now you know that there are 10 layers of the retina. I have just told you, and the inner layer of the retina, I am not saying neurosensory layer, boys and girls, I am saying inner layer of the retina is one layer, which is your neurosensory layer. What is neurosensory layer? No, neurosensory layer is inner 9 layers of the retina. The inner layer of the retina in ILM, which is inner limiting layer. Inner, I am writing it, yes, inner limiting layer. Okay, now this inner limiting layer goes beyond the retina and forms the inner layer of the ciliary body. So if I may ask you, what is the name of the 5th layer from outside? 5th layer from outside, 1 2 3 4 5. 5th layer from outside of that of ciliary body, that is inner limiting membrane or inner limiting layer, which is nothing but the continuation of the inner layer of retina itself. Yes, okay, now you know what are the remaining layers of the optic cup which are left. So now the 8 layers, yes, which is neurosensory layer, which was neurosensory layer in retina, and the outermost layer, which was RP in retina. Now this is what? This is epithelium only. Yes, so it is going to form the non-pigmented epithelium. So this is non-pigmented epithelium layer of ciliary body. Yes, but this RP, which was forming the retinal pigment epithelium of the retina, it will move forward and it is going to form pigment epithelium of the ciliary body. Yes, now we have got 3 layers, which is nothing but the extension of the optic cup only. The inner layer is inner limiting membrane, then the remaining 8 layers which are going to form non-pigmented epithelium, then the outermost retinal pigment epithelium. But when it will extend towards the ciliary body, it will be called as just pigment epithelium, not retinal pigment epithelium, because retinal pigment epithelium is the same pigmented layer which is there in the retina. But this is not the retina, this is the ciliary body. So you will call it as pigment epithelium. Then of course, any structure in the body has got stroma, and any structure in the body has got the outer wall. So then there will be stroma, and then ultimately there will be first layer. I told you the layers from outside. So first layer will be supraciliary lamina. I hope it is understandable. Supraciliary lamina. So let's recapitulate the layers of the ciliary body from outside to inside. So outside we have got supraciliary lamina. Supra means above, ciliary means ciliary body, lamina means layer. Supraciliary lamina. Then we have got stroma. Then we have got pigmented epithelium, the same extension of retinal pigmented epithelium. Then we have got non-pigmented epithelium, the same extension of the inner 8 layers, and then inner limiting layer, which is nothing but that neurosensory layer had got 9 layers. So one is inner limiting layer, another is your group of 8 layers, you call it as non-pigmented epithelium. So these are the 5 layers of the ciliary body. Just check this out. So from outside, supraciliary lamina, then stroma, then pigmented epithelium, then non-pigmented, then inner limiting layer or inner limiting membrane. Now please understand, this stroma and supraciliary lamina, they are formed of neural crest. How neural crest? Actually what happens is, when there is this optic cup, so it is surrounded by not air, it is surrounded by a mesenchymal tissue. Yes, this mesenchymal tissue. All right, so this mesenchymal tissue give rise to neural crest cells, which later form stroma and supraciliary lamina. I hope it is understandable. So these are 5 layers. Now when the ciliary body is formed, then again it will move anteriorly and then it will try to close. So please remember, when the optic cup closes, that means the closure of choroidal fissure, which is in the embryogenesis phase of eye. So that is always from superotemporal to inferonasal. That is why the most common site of coloboma is inferonasal. Yes, not inferior, not superior, not lateral, not medial. It is inferonasal. I hope you have understood. Now when this cup is, getting closed, so inner limiting layer or inner limiting membrane, which was the 5th layer of the ciliary body, it is there till the ciliary body only, and it does not extend beyond the ciliary body. So that means the 2 layers will be extending forward. One will be your non-pigmented epithelium, another will be pigmented epithelium. But there is one magic which is happening. What is that magic? That during the transition from ciliary body to iris, the pigmented epithelium loses pigment, the non-pigmented epithelium gains pigment, such that the deep layer of the iris, or there are 4 layers of the iris, because inner limiting layer is there till ciliary body only, rest 4 layers. So the 4th layer from outside is actually now pigment epithelium. You can see in the diagram, and the layer which was pigmented in the ciliary body, it loses pigment such that it comes to lie anterior to the pigmented epithelium. So this becomes non-pigmented epithelium. Now you are already aware of the 2 layers. One is pigmented epithelium, which is posterior most, then non-pigmented epithelium, which is anterior to this. But as I told you, that optic cup is surrounded by mesenchyme, and mesenchyme leads to formation of stroma as well as that of the anterior lamina of the ciliary body, which was supraciliary lamina. Here it is also going to lead to stroma and anterior lamella. You call it as anterior limiting layer or external limiting layer. So 4 layers of the iris are there, from anterior to posterior: anterior limiting layer or external limiting layer, then stroma, then your anterior non-pigmented epithelium, 4th posterior pigmented epithelium. So there are 4 layers which are present in the iris. Yes. Now you need to understand one important concept. What is that concept? So ciliary body, we talked about ciliary body. Ciliary body has got muscles in the stroma. Those are known as ciliary muscles. Now these ciliary muscles are actually derived from neural crest. But here you know that iris also has some muscles. What are those muscles? Those muscles are your sphincter and dilator pupillae. Now sphincter and dilator pupillae, you might think that it is derived from mesoderm, because all the muscles in the body are derived from mesoderm except ciliary muscles, which are derived from your neural crest, your INICET November 2024 option, and your sphincter and dilator pupillae, which is derived from, don't say neural crest, although they are present in stroma, but they are secreted by anterior non-pigmented epithelium. And you know, anterior non-pigmented epithelium is the part of the optic cup, which is coming from optic stalk, which is coming from diencephalon, which is a part of prosencephalon. Prosencephalon is neuroectodermal in origin. So sphincter and dilator pupillae are neuroectodermal in origin. This is one very important question for you guys. Okay, now coming over to the answer. So the answer is, which of the following is true? So you need to tell me the right answer. So if I check this, so there are 4 layers. Stroma lies between anterior limiting layer and anterior epithelium layer. Which is correct or false? Yes, this is the correct answer. Rest the options are incorrect. 4 layers. Anterior epithelium is pigmented. No, it is the posterior epithelium which is pigmented. Anterior epithelium is non-pigmented in iris. 5 layers of the iris? No, there are 4 layers of the iris. 5 layers? No, there are 4 layers. So and answer to mark is your answer C. I hope most of you students have got this correct. Okay, now coming over to corneal endothelium. So what is the function of corneal endothelium? Maintains detergence of stroma through an ATP sodium potassium dependent pump. Yes or no? Receives its nutrients from blood vessels surrounding the stroma. Okay, and undergoes multiplication in response to trauma, and produces trabecular meshwork. No, it does not produce trabecular meshwork. It does not undergo multiplication. Corneal endothelium cannot regenerate. In fact, it goes on for polymegathism. What is polymegathism? Polymegathism is a phenomena in which when an endothelium cell dies, the surrounding cells, they increase in size to take up the place of the dead endothelium. It receives its nutrients from blood vessels surrounding the stroma. It majorly receives its nutrients from the aqueous humor directly, and so it is also not the right answer. It maintains detergence of stroma through an ATP sodium potassium dependent pump. Yes, there are sodium potassium dependent pumps which throw 3 sodium inside the anterior chamber. It takes 2 potassium inside the stroma, and water follows the sodium so that the cornea is maintained in a dry state, and as a result of which the cornea remains clear. There was another question that there is one chemical in the cornea which helps the cornea maintain the dry state, that is keratin sulfate. This is also your previous year question. Yes, okay. Now expulsive hemorrhage in cataract surgery is due to rupture of expulsive hemorrhage. Expulsive hemorrhage happens to be when you are operating the patient of cataract, expulsive hemorrhage, and there is suprachoroidal hemorrhage. Suprachoroidal hemorrhage is very dangerous complication and it can lead to retinal detachment. So once there is expulsive hemorrhage, you need to stop the surgery there and then. You may even have to go on for sclerotomy, but it is due to rupture of what? For that you will have to see the image, so you can see what is the blood supply of uvea. So there are 3 major blood vessels. One is long posterior ciliary artery, one on the nasal side, another on the temporal side. It is unbranched and it goes till the base of the iris. Number 1. Second is there are short posterior ciliary arteries which are 10 to 20 in number. They perforate the posterior surface of the sclera just around the optic nerve, and they enter into choroid, forms the choroidal capillaries and remains there. Third, anterior ciliary arteries, they are 7 in number, 2 from superior rectus, 2 from medial rectus, 2 from inferior rectus, and 1 from lateral rectus. But you need to understand, anterior ciliary artery and long posterior ciliary artery, they make anastomosis at the base of the iris. You call it as circulus arteriosus major or major arterial circle. But that is important in case of blunt trauma, because if there is hyphema, which is blood in the anterior chamber, in case of blunt trauma, it is the source of hemorrhage. But we are talking of hemorrhage during the cataract surgery, which is expulsive hemorrhage, which is suprachoroidal hemorrhage. So when you are operating the patient, you are giving an incision, and when you go deep, so there is actually damage to the short posterior ciliary arteries, which are forming the choriocapillaries. Can you see these choriocapillaries? Yes. So this is the source of expulsive hemorrhage. When there is damage to the choriocapillaries, there is collection of the blood between the sclera and the choriocapillaries, which actually collects, because sclera is hard, it does not expand outside, it pushes towards the choroid, and choroid further pushes inside, leading to retinal detachment. Yes, so that is expulsive hemorrhage. So the source of blood in expulsive hemorrhage is your short posterior ciliary artery. Okay. Okay, now distance of fovea from optic disc. So this is your retina and this is your optic nerve. So what is the diameter of optic nerve? 1.5 millimeter. So this is your fovea. So the distance between the fovea and the optic nerve head is actually 3 millimeter, and I told you what is the diameter of optic nerve head. It is 1.5 millimeter. When it is 1.5 millimeter and the distance is 3 millimeters, so that actually means 2 disc diameter. So 2 disc diameter is 2 into 1.5, which is 3 millimeter, and hence the answer here. Okay, now persistent hyperplastic primary vitreous is due to what is PHPV. So for that you need to understand blood supply of the developing lens. So it has got 3 vessels, which is actually a branch of nothing but one artery, which is your hyaloid artery. So this is your hyaloid artery which is coming. So it is divided into 3 parts. One is anterior pupillary membrane, second is posterior pupillary membrane, and the equatorial is capsulopupillary portion. And when there is, basically what happens, there is complete absorption of the hyaloid artery, leading to formation of cloquet canal. Yes, cloquet canal. But when there is complete remnants of hyaloid artery, so you call it as PHPV, persistent hyperplastic primary vitreous. So hyaloid artery is actually known as primary vitreous. When the cup is closed, there is hyaloid artery which is absorbed, and there is secretion of the secondary vitreous. And mind you, this secondary vitreous come from the cup itself. So the source of secondary vitreous is cup. That is why secondary vitreous is neuroectodermal in origin, but the PHPV is actually mesodermal in origin, because hyaloid artery is mesodermal and it is nothing but the remnants of hyaloid artery. I hope you have understood. So these are the few points which are very, very important, and we tend to do mistakes, and I hope these few question discussion will help you. So I would suggest you to go for all the quiz discussions on the YouTube channel, and it is definitely going to help you, right? So with this, I am signing off. I wish you all the best. Take care, and in case of any queries, you can post in the comment section below, and do share your honest feedback with me. Thank you very much.